Hey everybody, thanks for joining us today for the RPH Ally Peer Support Show. Today we have a very special guest, my friend Jake Nichols, and we are going to do a quick Q&A. It's going to be fun, it's going to be very informative, and we're going to get to that right after this. Awesome. All right, Jake. Well, thanks again for joining us today. It's always nice to have you on.
Always a pleasure, my friend.
All right. So I didn't give you these questions in advance, mainly because I know you're going to know a answer to them. Maybe not the answer.
Yeah,
I think
sure.
to answer some of these questions, it takes a very, very long time. But I wanted to know your answer to these questions, because these are questions I think we all have. And I think of people who really aren't familiar with substance use disorders. For example, I think of my wife, and all this stuff is very foreign to her. She's never touched a substance in her life. She doesn't get why people do that. Don't they know they're bad? Don't they know, there's a lot of consequences, all that sort of stuff. So why would you ever do that?
Yeah.
And so my first question for you, why do people start using drugs or abusing substances?
Wow, this is a great question. And I know you want to do this rather quickly, but we could talk about this for 4 or 5 hours.
That's what I said.
In circles here, I'm sure. That's a great question. And if I can give you an analogy that a lot of people in the field discuss, it's the chicken or the egg phenomenon. When we talk about substance use, I mean, one thing that's universally accepted is that it is usually the result of trauma. Usually what starts it off is experimentation for most of us. Most of us are not consciously seeking drugs for escape. It's more of a subconscious issue. And then once our brain realizes that it is such a potent and effective way to escape, right, especially if they're wired the way that I am, then it becomes something that's continuous. So, it starts as experimentation for most, and data supports that and all the big studies that we've done. But again, what perpetuates it is the body's response, A, and your genetics, but B, its effectiveness in mitigating and dampening those traumas or those issues that you're struggling with.
Yeah. So it's these traumas that cause people to feel maybe bad about themselves, cause them to be depressed, maybe causes them to be anxious. There's some anxiety there. And so they take these drugs, and it makes all of that go away.
Yeah. I think in my case, just to kind of bring it, to reality here, when I look back when I was diagnosed with anxiety and depression at age 18, and where my substance use kicked off soon after that, I think part for me was the fact that my depression wasn't adequately treated. Yeah. And obviously, again, the way I'm wired and genetically predisposed, the way my body responds to substances has a tremendous antidepressant effect.
Yep.
So we hear the term self-medicating a lot, which I like because it helps us understand why somebody would perpetuate their substance use if they have a depression or anxiety component, or even bipolar. We see that a lot, people trying to balance themselves out.
Yep.
But also, it doesn't take into account the fact that there's this underlying true behavioral health issue that has been either neglected or suboptimally treated.
Yep. I definitely relate to that as well, using it to calm some of the traumas. I know when I first started using substances, especially opiates, I have that mind that always races. Your mind needs to slow down at some times. The mind's constantly going. I'm always thinking about something, no matter what it is. I mean, just go, 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 go. And that's difficult to live with a racing mind. And I know when I first started, whether it was alcohol or later opiates, that stopped. And that relief was just so great. I was like, man, it's so nice just not to be thinking about every single thing in the world and all these problems all the time.
Right.
The next question is kind of go along with the first one. Many people, including myself, and I believe yourself as well, we start using these substances and we experience terrible consequences, right? That really, and I think we can acknowledge, outweigh using the substance. It's like, man, at first I thought it was okay to use a substance, yet I got in big trouble, and now I'm looking at, whether it's criminal accusations, marital problems, whatever it may be. I need to stop. Yet we don't.
Right.
We continue using. So like cognitively, We know it's bad and it's not worth it. Why is it so hard just to put it down and say, hey?
This is a great question. It's, when I tell my story, one of the things that I say right up front is the fun that we experience through our substance use goes away very quickly.
Yeah.
The enjoyment is very short-lived. And to your point, what comes quite rapidly is this need to maintain almost a baseline.
Yeah.
And there's, not to get too technical here, but there's pathology behind that. There's biology behind that. And when somebody like you or I takes a substance and we have that reaction where our brain is flooded with this exponential amount of dopamine, that's more than, we're in the 10% group. Only 10% of us really respond like that. When that happens, it leads to a rewiring of the brain. You have now a new set point. That's your pleasure set point. And your brain enjoys it so much that it literally burns that into the most elemental parts of your brain as a survival mechanism. And that's what we're trying to maintain along the line. We call it chasing the high, because we can actually never duplicate that feeling that we first experienced when we used our first drink or our drug.
Right.
So it's really that's where it becomes a brain disease, where the brain is saying, I need this level of dopamine stimulation and enjoyment to be able to continue functioning. And if I don't have that, I'm going to rebel and I'm going to make you feel terrible. And that's
Yeah. And when you mentioned that I'm going to make you feel terrible, that's what made it real difficult for me. I'm the kind of guy, like if I get sick, like with a cold, I hate being sick. I mean, I am miserable. Like my wife, for example, she gets sick and she's a trooper. She could power through it. Not me. I hate it. And so the same thing when you're having these withdrawal symptoms, even when they're mild at first, I hate it. I can't stand it. I'm like, make that feeling go away, make it go away. And I hate it so much that I'm going to put those substances back in my body, despite knowing I shouldn't be doing that. I hate that feeling of withdrawal so bad. I'm going to do it anyway. It's amazing the power there.
It really is. The fear of going into withdrawal is paralytic. And literally, people think we kind of wait till we get to the point where we're in withdrawal and we then seek the substance again. No. We're paranoid of even getting close to that point. So we try to get as much drug as we can. We try to hoard it. We try to always make sure we have a supply. So we're never in that situation.
And the strength of that withdrawal and those symptoms is more than anybody can ever imagine. Because I remember before I really got into my addiction, I knew there was the potential for addiction and withdrawal, but I was like, how bad can it be? Like, I've been through a lot of stuff in my life. I can go through withdrawal and get over it. It's not going to be that bad. But man, I mean, it was literally 100 times worse than I ever could have imagined.
Absolutely. I mean, we think back to what we were taught in school about what withdrawal was. And to be honest, we also think about the interactions we had with patients as a pharmacist that were potentially undergoing withdrawals or experiencing that type of behavior because they were worried about going through withdrawals. Many of us judged that, as I did, even as an addict. And that piece is, as I say, it's, if there's a hell, that is what it is. I wouldn't wish that on my worst enemy. And again, with opioid withdrawal specifically, we're always taught about the physical signs and symptoms, right? It's the sweating, it's the cramps, it's the GI, it's the legs. There's a huge psychological component too, because your brain chemistry is completely gone haywire and is almost completely absent. So the depression that lasts, and for me, stimulants being a part of it, it's even worse, is very prolonged. The physical piece goes away kind of quickly. It's still absolutely torturous, but at least it's somewhat terminal. The psychological piece, the depression, persists for months, if not years after.
And along with that too, in my experience, is fear. I remember being afraid of everything. You're going through that withdrawal. You're extremely depressed, but just having this overwhelming fear.
Absolutely.
That life is going to never be good again. You're afraid of every single little thing. I just remember that crippling fear. And that was like the worst thing I remember identifying was fear.
Very well said. It almost seems like the word doesn't do that feeling justice.
No, it doesn't.
To your point, you feel like there's nothing positive, and you're afraid that everything is coming down around you. And again, now that we have some time to understand that, we understand why that is and biochemically why that happens.
Yep. Yeah, I remember there was a pharmacist I was speaking to the first time I went to inpatient. Well, the only time I went to inpatient, but my
Yeah,
first time into treatment. And I was telling him that, and I was like, dude, I'm afraid what's going to happen. And he's like, dude,
yeah,
you have nothing to be afraid of. Like,
yeah,
you're getting the treatment you need. Like, nothing
right.
bad has happened. You're going to be fine. Why are you afraid? And
Yeah,
I was like, I don't know. I just have this overwhelming
yeah,
feeling of
yeah.
fear,
As did I. Yep.
and it's terrible. And he's like, there's nothing to be afraid of. And really, there wasn't anything to be afraid of. But yeah, it's all
No,
in my head.
right.
Um, next question. Next question. If you could provide one solution to eliminate substance use disorder, whether it's actually possible or not,
Yeah.
what would you do? What would you do?
Wow, that's one of the best questions I've gotten in a long time. If it's a pie in the sky thing, there's an easy answer. We need to be nicer to each other as
Yeah.
human beings. I don't know any other way to say it. We need to demonstrate caring and support of one another.
Yep.
But if we were to bring it down to a more clinical level, you know, what makes the difference, at least in my opinion, in 13 years of recovery and working in this field, is the support network. We have some great medications for certain substance use disorders. We have some great treatment programs out there. We've gained a lot of knowledge, especially over the last decade. But in my experience, if you don't have a solid support network around you,
Yep.
the likelihood of you failing is very high.
Yep.
And if I can use you as an example for a minute,
Sure. Sure.
you had an incredible experience of having a spouse who supported you, encouraged you, and continues to do so. You have two incredible little guys at home. That's your support network. Your family is your support network. Beyond that, you have us, the
Right.
rest of us in the profession that have struggled with this. So you've been wise in being able to kind of identify your support network and lean on those individuals.
Yep.
There are a lot of people out there that still struggle doing that. And when somebody says, well, I can't find a support network, I can't buy that. You can find one at meetings. You can find one at support groups. There are
Yep.
plenty of places you can find support.
Yep.
But that's truly what makes the difference. So if people could, I guess to answer that question, to change one thing, if everybody that struggled with this was able to ask for help and to open up and talk to people and say, I need people around me that are going to
Yep.
help support me and bring me up. And most importantly, keep me on this path because it's going to
Yep.
be hard.
Yep. That would have been my exact answer as well. You mentioned the peer support. I mean, on RPH
Yeah,
Ally here, I created the peer
yeah,
support channel. And if
yeah,
you go onto that channel and you read the description and the about me, I
yeah,
say just that. I talk about the power of peer support. And I say
yeah,
there's a lot of other good treatment modalities out there as well, psychiatric care,
yeah,
therapy, mindfulness, a number of things out there that are really helpful. But for me, it's been the power of peer support. Know you're
yeah,
not alone in this, and that if you are having a difficult time, you could reach out to somebody and get the help that you need.
yeah,
And just the power in that is huge.
yeah.
Nobody needs to go through this alone,
No,
and it's almost impossible to go through it alone. So if
yeah,
somebody's out there watching this, like, and you're struggling, reach out to somebody. If you have nobody to reach out to me on RPH Ally. Find me on
reach out to
social
me,
media. I'd be
right?
love to talk to you. Reach out to Jake,
Yeah,
and definitely provide you with that support you need.
yeah,
Last question here, a little similar, but I want to direct it specifically towards the government. If
yeah,
there's one thing that the government would be able to do to decrease the incidence of opioid use disorder, substance use disorder in this country,
yeah,
which we know is extremely high
yeah,
prevalence at this time,
yeah,
what would it be? And one of the things I think about is, like, what if you had free treatment? I know cost of treatment's a barrier for a lot
yeah,
of people, but
yeah.
what would you say is one thing the government could implement to help this problem we're
Sure.
seeing?
Yeah, I mean, my answer is similar to yours. I think free treatment or more accessible treatment to me is the answer. The government is political, to state the obvious.
Yeah.
And the government goes where the media attention is and where the administration is. And right now, and again, I've been very lucky to be involved with some of these initiatives, but the White House is focused on getting naloxone out. And I think we'd both agree that's an essential piece of this puzzle. People are
Yeah.
dying. Our first goal of all of this is to stop people from dying. But I think we've also lost sight of what you and I are talking about here is treatment,
Yeah.
because treatment does work. Different modalities of treatment are essential. We need to have evidence-based treatment programs. if they're going to be funded. Some of these ancillary things and things that we just don't have evidence for can be great adjuncts in the face of, if you're being treated with medications and counseling and other things that, again, are evidence-based and we have a lot of data to support.
Yep.
But that would be my, and I've been asked that question by the director of the Office of National Drug Control Policy. He said, if there's one thing we could do, what could we do? I said, we need more treatment.
Yeah.
And that's just not my opinion. The data supports that. Studies have been published. We talk about mental health in general. There's no greater shortage of clinicians in any area of medicine than there is in mental health.
And that's worsening.
It's worsening tremendously. I mean, you talk to anybody, I don't care where you go around the country, you ask anybody how easy it is to find a therapist or a psychiatrist. It is not easy. It is not easy. So to your point, making that more accessible is really where I think we need to put our money.
What about the idea of getting more strict on, having these drugs out there, stricter controls at the border, stricter controls with prescribing and things like that? Do you think that's even do you think that's an answer? Do you think that's even possible? I mean, could we just go gung ho crazy with that, and would that work?
Well, yes and no. I think, and again, this is my opinion, and obviously things get political here. I think we've gotten, and let me first start by saying I'm a big advocate for harm reduction because I think that's where we're at. But again, I think we've moved too far towards that spectrum where we're saying, well, maybe we don't need to have law enforcement. We don't need to have border control. We just look at where these fentanyl analogs and where nitazines are coming from. We all know where they're coming from. The fact that we can't put more resources into that. And you talk to border control and you talk to those guys they are completely under-resourced and understaffed. I sat in a presentation recently and they talked about the percentage of cars and folks that are coming through the border that they check, and it's like single digits just because they don't have the resources to do that. So I think as it relates to especially other countries getting this stuff across our borders, that's where we need to focus our efforts. My personal opinion on the prescribing piece is that should be left to state boards and state law enforcement. I think the DEA should be focusing their efforts on border issues and cartels and those things that are truly contributing a great deal to this. But I think honestly, we spend too much time at this point going after doctors. There's some folks out there that need to be brought to justice that are doing horrific things. It's nowhere near the way it was 20 years ago. But again, if we had to pool our resources, I'd say let the states handle that. Let the states handle licensees and docs and prescribers, and let the DEA go after the cartels.
Yeah, that makes sense to me. And there's probably also a piece in there too with the education for these physicians who are prescribing the medications.
There certainly is.
I think a lot of times physicians, they may think that's really the only choice for that patient. This patient's been on opiates for 10 years. They have chronic pain due to, orthopedic condition. It's like they're not making this up. So therefore I'm going to prescribe, 240 Norcotins a month, month after month after month. And that's what they do. And they think it's okay. And that becomes normal. Maybe, educating these providers on non-narcotic means of pain reduction. And I'm sure that they know this, but it's not the norm. So maybe to make that a little bit more of the norm to help prevent this problem and just stop getting so many opiates out there on the street.
Yeah, I agree. I think people assume that, especially pain specialists are well aware of the non-opioid treatments. I would never assume that. It's a great role for us as pharmacists. And I acknowledge it puts us in a tough spot sometimes. We try to make those recommendations and we get somebody saying, who are you to tell me what I should be prescribing for my patient and that type of crap. But, we're part of the healthcare team. And trust me, there have been many occasions, even with addiction docs that I interface with on a regular basis, are saying, I'm still struggling here. I don't know how to treat this person's pain in the face of their opioid use disorder. And I said, well, have you even thought of this? Have you tried? Oh, no, I forgot about that. Use that? Oh, okay. Let me give that a shot. So again, great role for our profession. And there is definitely an educational gap still out there.
Yeah. And it's not easy. I mean, treating chronic pain is extremely difficult. There's a lot of
envy those folks at all.
A lot of factors involved.
Yeah, to some degree, I have respect for some of those docs out there that truly take those pain patients that nobody wants, that nobody wants to deal with, because that's a tough spot, and we don't want people to suffer, certainly.
Definitely not. Definitely not. Well, Jake, we're going to wrap this up. Thanks again for joining us. And I think the number one takeaway for all of us is what you said: to reduce the incidence of substance use disorder in the communities is to be there for one another, be kind to each other, love each other, support each other, and you really do the right thing, because when people are experiencing trauma, going through a difficult time, that's most likely going to lead to them using substances. And if we can not put them in that situation so they don't have those feelings, then we're going to decrease the chances that anybody's going to go that route and ultimately have better outcomes for everybody.
Yeah, well said.
So Jake, thank you again. Until next time, take care.
Always a pleasure. Thank you.
All right, bud.
Take care.